My favorite thing about the nursing school at Duquesne is that we don't have to just take core classes our freshman year. We actually get to take nursing classes, so we're like a jump ahead of everyone else. What's yours?
I'd have to say my favorite thing about being a Duquesne University nursing student would probably be the teachers and how reliable they are and how easy it is to talk to them and how I never felt uncomfortable asking for help or for advice, and they always offer up their time. It's amazing. I mean, it's really great.
My favorite thing about being a Duquesne nursing student is that you get to start your clinical experience like right your freshman year, like with the service learning. You get to go out into the community your first or your second semester, and it's really nice how we can do that here.
Okay, come on guys, we can't be late for the bus. It's the 71D, and then we have to transfer. What's our stop again, guys?
It's Hamilton and Homewood.
Oh, okay, good.
I'd have to say that my favorite part of the Duquesne nursing program would be all the people that they're just so helpful. I mean, you always can look for a friend in the class that, you know, if you don't remember an assignment or they do have it, and they'll always help you out. And it's just always a good, like the nurses are just a good group of kids that you always can count on.
My favorite thing about the Nursing Duquesne program is that there are a lot of nursing organizations. One that I'm involved in is NCF, which stands for Nurses Christian Fellowship. It's a non-denominational Christian organization where just a few nurses are involved, and we get together, we talk about our faith, we support each other through our classes, and we get involved in the community.
I mean, I think that my freshman year classes are really going to be like the base of all my nursing classes to come. It really gives me an understanding of what's to be expected, and learning things like nurse competencies and the synergy model that I'll use for the next 4 years are really important to understand now, and I'm really glad that I got to use that for my freshman year.
I just remember I have clinical tomorrow. I'm so excited.
Oh yeah, I had mine on Tuesday actually, and I was in an OBGYN clinic, and there was a woman who was 28 weeks pregnant, and the physician came in, and he taught me and my clinical partner how to do the fundal height, where you find the uterus, and you have the patient breathe in, and then when she breathes out, you can see the difference between like the uterus like here, and then the rest of the abdominal muscles that fall. So that was cool. So I figured out the fundal height. And then it was kind of crazy because he was like, oh, well, we're going to do the Doppler now to figure out the fetal heart rate. And he just like handed it to me so I could just find the fetal heart rate. So it was really cool.
Is that really cool?
Colleen, aren't you in a social sorority too?
Yeah, I'm in Greek life. It's fun.
Wait, is it? Can you balance it all? Like,
Yeah,
I hear like it's a
definitely.
There's a lot at one time.
Especially with like us nursing students, we have a lot of stuff on our plate, like we all know. And so it was definitely manageable. It was no problem. I got all my work done. And still kept good grades. So, and it's a lot of fun. Definitely. Cool.
I'm like having a brain freeze for real.
Left to right, oxygenated to deoxygenated, so that's a good thing.
It's not a good
Left
thing.
left to right. Oxygenated to deoxygenated.
Cyanotic.
Acyanotic.
Acyanotic. That's what I meant. Not.
So then right to left is deoxygenated to
Oxygenated, which is bad.
you're
That means
putting
you have deoxygenated blood
in
going
your
to your body.
So that's
The
why
other
you
way
become
means you have
cyanotic.
oxygenated blood going back to your lungs, which isn't
So
not
left
right,
to
but
right
it's
is
not.
acyanotic.
And that's increased pulmonary blood.
It might help if you like the chart in the book says like.
Good morning,
increased
Mrs.
pulmonary
Stevenson.
blood
How are you
flow.
today? Good morning, Mrs. Stevenson. We're just going to take your vitals. Is that all right? I'm Karen. My name is Amber.
And I'm Amy. We're Duquesne University nursing students. Amber's going to take your blood pressure, I'll take your pulse, and Karen...
And I'm going to check your fundal height. See how many weeks you are. Got our coffee, jump starting our our NCLEX studying. Yes, cannot wait to get this test over with.
What do you start with?
I have GI disorders here.
I'm gonna start with Deb's Diamonds or Diamond Deb's.
Oh, good one.
Maternity review.
Yeah, that's a good
that
review.
they gave us last semester because I know that's my weakest area.
I have health promotion and health maintenance.
Okay.
So how's your preceptorship going? Like, where were you again?
It's going really well. I'm on 9C at Allegheny General. It's a neuro surge floor, so I'm getting really, really good at neuro assessments.
That's awesome. That's an awesome floor to be on.
Yeah, it's really good to learn on. Where are you? Where are you?
I'm over at Mercy. I'm on the burn and trauma ICU. It's awesome. I was there last semester, and it was a really good 2 days that I was there, and I loved it. And then I ended up getting that for my preceptorship. So we do dressing changes on the burn patients, and it's interesting to see them on a ventilator, but then you wean them off, and then before you know it, they're walking back in to thank you for what you've done. So it's been great so far.
It's amazing. I feel like we all have definitely grown a lot in these 4 years. We have just learned so much. I remember sitting at an ATD meeting with when we were sophomores, and the seniors were talking about their clinicals and their preceptors, and they were talking about all this, these clinical terms and these medical lab values. And I remember thinking to myself, I have no idea what they're talking about. But now we can sit and have a conversation about it, and we know exactly what we're talking about. It's just amazing that even last year we didn't know half of what we know now. Clinicals is definitely where I felt like everything I learned in the classroom came together. Remember that lecture about art lines and like zeroing and all that? I finally saw that at clinical, and I said, oh, that's what they're talking about. So it's nice to be able to put everything together, all the pieces of the puzzle.
My favorite thing about the Nursing Duquesne
It really gives me an understanding of what's to be expected, and learning about my nurse darn.
Further, break the blade! Break the blade, push it out!
The blade, she's into my pelvis, man.
Today my patient was 85, but he was just admitted for low blood pressure.